Have you ever wondered what you would do if you suddenly felt a deep, pressing pain in your chest while you were home alone? It is a frightening thought, but it happens more often than many people realize. For adults over 60, this is one of the most dangerous moments, and knowing exactly what to do can make the difference between life and death. Many older adults hesitate when the first signs appear. They hope the pain will fade or think it might be indigestion, and they wait. But when it comes to a heart attack, every single minute matters. The faster you act, the better your chance of survival and recovery. After 60, the heart becomes more sensitive to stress, changes in temperature, and hidden blockages that can suddenly stop blood flow. The body's natural warning signals like chest pressure, shortness of breath, or pain in the arm or jaw should never be ignored. Recognizing these signs early and staying calm can save your life. This is Dr. Sam's Senior Health Tips, a channel that shares calm, science based guidance to help seniors stay strong, independent, and prepared for life's unexpected moments. Here, you will always find advice that is simple to understand and easy to apply in real situations. If you find this kind of information useful, remember to subscribe and tap the bell so you never miss a health lesson that could one day protect you or someone you love. In today's video, we will talk about 7 simple but powerful steps that can help you survive a heart attack, even if you are alone. These steps are practical, easy to remember, and designed to keep your heart pumping and your mind alert until help arrives. Take a deep breath, stay calm, and let us go through them one by one. Here are the steps one by one in clear, senior-friendly language. I'll correct one common myth along the way so you stay safe. Step 1. Call emergency services immediately. When a heart attack starts, the very first thing to do is call for help. Do not wait to see if the pain fades, and do not try to drive yourself. The first warning signs are often a heavy pressure or squeezing pain in the center of the chest that lasts more than a few minutes. It may spread to the arm, shoulder, back, neck, or jaw. You might feel short of breath, dizzy, or break out in a cold sweat. Some people feel sudden nausea or an unexplained sense of fear or weakness. These signs mean that blood flow to part of the heart has become blocked, and every minute that passes allows more damage to occur. Many seniors hesitate because they think the pain will pass or they do not want to cause alarm, but the heart muscle cannot wait. Calling emergency services brings trained professionals with oxygen, monitors, and medicine that can reopen arteries before they close completely. The sooner you call, the greater your chance of survival and full recovery. Pick up your phone right away and dial the emergency number in your country. In most places, it is one short number that connects you directly to medical help. Tell the operator that you are alone and may be having a heart attack. Give your exact address and any landmarks that make your home easy to find. If you have stairs or a gate, describe them so the rescue team can reach you quickly. Keep the line open and switch to speaker mode if possible. This allows the dispatcher to stay with you while you prepare for the next steps. They can guide you on what to do while help is on the way. Remember, no matter how strong or independent you are, the most important action in those first moments is to call for help immediately. That single decision can save your life. Step 2. Chew an aspirin. Don't swallow it whole. Once you have called for help and are waiting for the ambulance, the next important step is to chew an aspirin if it is safe for you to do so. A heart attack happens when a blood clot blocks the flow of oxygen to part of the heart muscle. Aspirin helps by thinning the blood slightly and slowing the growth of that clot, giving doctors more time to restore full circulation once you reach the hospital. You will know it is time to act if you still feel that same heavy pressure or squeezing pain in your chest that does not go away with rest, or if the pain spreads into your left arm, shoulder, or jaw. These are signs that the blockage is continuing and that your heart muscle is under stress. Acting quickly with aspirin can limit the damage before medical help arrives. If you have no allergy to aspirin and your doctor has not told you to avoid it, take one regular adult tablet, usually about 300 milligrams. Do not swallow it whole because it works faster when it is chewed. Bite it slowly and let it dissolve in your mouth with a sip of water if needed. Chewing allows the medicine to enter your bloodstream quickly through the tissues in your mouth and stomach. If you take prescription blood thinners or have stomach ulcers, you should follow the guidance your doctor gave you beforehand. Many seniors keep a small packet of aspirin in a place that is easy to reach, such as beside the bed or near the phone. It is best to plan ahead and ask your doctor during a regular visit whether aspirin is safe for you in an emergency. Once you have chewed the aspirin, stay seated and calm while you wait for help. Do not take more than one tablet and do not combine it with other pain medicines. The goal is not to stop the pain completely, but to give your blood a better chance to flow until the professionals arrive. This simple step can make the difference between a mild heart injury and a life-threatening one. Step 3. Loosen tight clothing and sit upright. After calling for help and taking aspirin if it is safe, your next step is to make breathing and circulation as easy as possible. When a heart attack begins, the heart struggles to pump blood, and the lungs can feel tight because fluid pressure starts to build inside the chest. Sitting upright helps reduce that pressure and lets your lungs expand more fully. It also helps blood flow from your heart to the rest of your body without making the heart work harder. Find a firm chair or sit on the edge of your bed with your back supported and your knees slightly bent. Avoid lying flat on your back because this position can make it harder to breathe and can increase the strain on your heart. Keep your head and shoulders raised and stay still. Movement or effort at this stage can worsen the pain or cause your heart to work too fast. Next, loosen any tight or restrictive clothing. Unbutton collars, loosen belts, undo ties, or remove scarves that press against your neck or chest. If you wear dentures, you can leave them in place so you can speak clearly to the emergency operator, but make sure nothing is pressing against your throat or chest. These small adjustments help your body take in more oxygen and keep blood circulating more freely. If someone is nearby, ask them to open a window or turn on a fan for a little fresh air. This can help you feel calmer and more in control while you wait for medical help to arrive. Try to breathe gently and slowly, in through your nose and out through your mouth, counting to 3 with each breath. Calm breathing lowers the heart's workload and helps your body use oxygen more efficiently. Most importantly, stay seated and avoid unnecessary movement. Do not try to stand up, walk around, or fetch anything. Help is already on the way, and your focus now is to stay comfortable and keep your heart as steady as possible until the professionals arrive. Sitting upright with loose clothing is one of the simplest but most effective ways to ease the strain on your heart during these critical minutes. Step 4. Unlock the door and keep your phone with you. Once you are sitting comfortably and breathing steadily, your next priority is to make sure help can reach you quickly when it arrives. During a heart attack, even a few minutes of delay can make a big difference. Paramedics may lose precious time if they have to break a lock or look for a way inside. That is why it is important to unlock your main door as soon as possible, while you still have enough strength and awareness to move safely. If you live alone, take your phone with you. Walk slowly and carefully to the front door, unlock it, and if possible, leave it slightly open. Do not rush or make sudden movements. Move only as much as you need to and rest your hand on a wall or table for balance if you feel dizzy. Once the door is unlocked, go back to your chair or a safe sitting place and stay there. If you have a gate or a security system, make sure it is open or easy to access. Turn on your porch light or any nearby light so emergency responders can identify your home quickly, especially at night. If you have pets, close them in another room so they do not get in the way when help arrives. Keep your phone in your hand or next to you on speaker mode so that the emergency operator can continue talking to you. Follow any instructions they give and tell them if your pain worsens, if you feel lightheaded, or if you start to have trouble breathing. They are trained to guide you step by step until the paramedics reach you. This simple step, unlocking your door and staying close to your phone, ensures that help can find you without delay. Many lives are lost not because help was unavailable, but because rescuers could not reach the person in time. By preparing your space and staying connected, you give yourself the best possible chance of being treated quickly and safely when every second counts. Step 5. If you feel faint, stay still and try to stay conscious. During a heart attack, you might suddenly feel lightheaded, weak, or as if you are about to pass out. This happens because your heart is struggling to pump enough blood and oxygen to your brain. When this occurs, the most important thing is to stay as still as possible. Keep your airway open and do everything you can to stay conscious until help arrives. If you feel faint, do not try to stand or walk. Stay seated and lean slightly forward to make breathing easier. Place your elbows on your knees and lower your head towards your chest if that feels comfortable. This position helps blood flow to your brain and can reduce dizziness. Focus on taking slow, steady breaths through your nose and out through your mouth. Try to keep your breathing calm and even, because panicking can make the heart beat faster and reduce oxygen even more. If you are near a soft surface, such as a carpet or couch, you can slide down carefully from your chair and lie on your side with your knees slightly bent. This position keeps your airway clear and prevents injury if you do lose consciousness. Keep your phone on speaker beside you so the emergency operator can continue to monitor your condition. Tell them what you are feeling, if your vision is dimming, if you are sweating heavily, or if you are finding it harder to breathe. These details help rescuers understand how quickly they need to act. You may have heard advice about coughing hard during a heart attack. This so-called cough CPR is not recommended for people who are alone at home. It has not been proven to save lives and can actually waste precious energy or make your condition worse. Instead, focus on staying calm, breathing evenly, and keeping your body as still as possible. If you do lose consciousness, the emergency team will take over as soon as they arrive. Your main goal right now is to remain aware, protect your breathing, and keep your body in a safe, relaxed position. Every second you stay conscious increases the chances that help will reach you in time. Step 6. Take slow, steady breaths, and stay calm. While waiting for help, your heart is already under heavy strain, so the way you breathe can make a big difference. Slow, steady breathing helps lower the heart's workload, brings more oxygen into your blood, and keeps panic from making your symptoms worse. Fear and anxiety can cause your body to release stress hormones that make the heart beat faster and harder, which is the last thing you need during a heart attack. Start by closing your eyes for a moment and focusing on your breath. Inhale slowly through your nose, letting your stomach rise as the air fills your lungs, then exhale gently through your mouth. Try to count silently. Breathe in for 3 seconds, hold for 1, and breathe out for 4. The goal is not to control every breath perfectly, but to find a calm rhythm that feels natural. Keep doing this for as long as you can. It helps keep oxygen flowing to your heart and brain and gives you something steady to focus on instead of the pain. As you breathe, remind yourself that help is already on the way. You have done the most important things, and you have called for help, taken aspirin if safe, unlocked the door, and are staying as still as possible. Now your task is to stay calm and keep your body stable while waiting for the paramedics. If you start to feel anxious or your mind races, quietly repeat simple phrases like, I am calm, help is coming, I can breathe. This gentle self talk slows your thoughts and keeps your body from reacting with more stress. If someone is nearby or on the phone with you, tell them to speak softly and stay on the line. Hearing another person's voice, even over the phone, can help you feel grounded and less afraid. Try not to move or talk too much. Save your energy and let your heart rest. Focus only on your breathing and staying conscious. This calm, steady state helps your body hold on until medical professionals arrive. Every calm breath keeps oxygen flowing where it is needed most, to your heart and brain, giving you the best chance for recovery. Step 7. Keep a heart emergency card and be prepared. The last step is about preparation because what you do before an emergency can be just as important as what you do during one. A heart emergency often comes without warning, and in those moments it can be hard to speak clearly or remember all your medical details. Having your information ready can save precious time and help paramedics give you the right treatment the moment they arrive. Start by writing down your essential information on a small card. Include your full name, age, home address, emergency contacts, and any medical conditions such as high blood pressure, diabetes, or heart disease. List all the medications you take, along with their doses and the times you usually take them. Add any allergies or medicines that cause you side effects. If you use a pacemaker or have had surgery, note that too. Keep this card near your phone, in your wallet, or taped to the refrigerator, somewhere easy for rescuers to find. Many seniors also store this same information in their mobile phone under a medical ID feature. Emergency workers can access it from your lock screen even if you cannot speak. You can also keep a small supply of aspirin near your emergency card if your doctor has said it is safe for you to take in a crisis. If you live alone, tell a close neighbor or family member where your emergency card is kept. You might also give them a spare key or set up a smart lock code so they can help emergency responders enter quickly if needed. Simple tools like a medical alert bracelet or pendant can also connect you to help with one press of a button if you cannot reach your phone. Preparation is an act of care for yourself and your loved ones. You hope you never need to use these tools, but having them ready gives you peace of mind. In an emergency, that small card or alert device could give doctors the information they need to act fast and protect your heart. By keeping your medical details close, staying calm, and following each of the previous steps, you give yourself the best possible chance to survive a heart attack, even if you are alone. These steps are meant to keep you alive until help arrives, but they are not a replacement for medical care. Every heart attack is different, and what your body needs may depend on your health history, your medications, and the strength of your heart. The most important thing to remember is that speed and preparation save lives. If you have ever been told that you have heart disease, high blood pressure, or cholesterol problems, talk with your doctor before an emergency happens. Ask them what you should do if chest pain starts when you are alone, and whether aspirin or other medicines are safe for you. Keep their instructions written down in the same place as your heart emergency card so you do not have to think under pressure. Never try to drive yourself to the hospital, even if you think you can make it. Many people lose consciousness on the way, putting themselves and others in danger. Sit down, call for help, and wait where emergency workers can reach you quickly. If you live alone, you can also consider a medical alert device that connects directly to a call center at the push of a button. Some of these devices even work outside the home, giving you extra safety when you go for a walk or run errands. If your pain goes away after a few minutes, do not ignore it. Heart attacks sometimes come in waves, easing for a short while before returning stronger. Even a mild or short-lasting episode means your heart is under stress, and you should be checked immediately. Tell the doctors everything you felt, including where the pain started and whether it spread to your arm, jaw, or back. These details help them understand what happened inside your heart. Finally, remember that keeping your heart healthy each day is the best way to prevent emergencies. Eat plenty of fruits, vegetables, and whole grains. Stay active with gentle exercise like walking, and manage stress through relaxation and breathing. Small, steady care today builds the strength your heart needs tomorrow. When you stay prepared, calm, and informed, you give yourself the greatest protection possible. A strong heart, quick action, and clear thinking can save your life, even if you are alone. You have now learned the 7 simple actions that can save your life if a heart attack strikes while you are alone. These steps are not complicated, but they must be done quickly and calmly, because every second matters when your heart is in distress. The first and most important step is always to call emergency services. Never wait, never drive yourself, and never assume the pain will go away. While help is coming, chew an aspirin if it is safe for you. This helps slow down the clot that blocks blood flow to your heart. Then loosen any tight clothing and sit upright so your lungs can expand and your heart can work with less strain. If you start to feel faint, stay still, breathe slowly, and focus on staying awake. Unlock the door, keep your phone near you, and follow the dispatcher's instructions until help arrives. When you are breathing calmly and waiting, try to stay as relaxed as you can. Panic is natural, but calm breathing protects your heart by keeping oxygen levels steady. Keeping a heart emergency card ready is another small but powerful way to prepare. Write down your medical conditions, medicines, and contacts, and keep them near your phone or in your wallet. These small details can guide doctors and save precious time. Remember that these steps are for emergencies, not a cure. You should always work with your doctor to keep your heart healthy and to understand your personal risks. Ask if you should keep aspirin nearby, whether your current medicines affect your heart, and what plan they recommend if symptoms appear again. The more you know ahead of time, the safer you are. Most of all, keep hope and awareness in your heart. You are stronger when you are prepared. Share this knowledge with friends and loved ones, because one day it might save someone you care about. If this lesson was helpful, please like the video, subscribe to Dr. Sam Senior Health Tips, and tap the bell to stay informed. Together, we can build habits that protect the heart and bring peace of mind at any age. Here's to a calm mind, a strong heart, and many more healthy years to come.